In this RCM Roundup, I discuss the Medicare Open Enrollment season and what that means for our elderly population here in the United States of America. Check it out. And I just want to let you know, if you have a parent or a grandparent who is 65 or older and they have Medicare, that this is Medicare Open Enrollment season. Now, just to give you a little context, when our parents or grandparents become Medicare eligible, they get Medicare Part A and Medicare Part B. Medicare Part A covers, institutional services. So if mom, dad, grandma, grandpa need to go to a hospital, those claims get billed through Medicare Part A. Medicare Part B is physician services. So if they're seeing doctors in the clinics, if they're seeing doctors in their offices, their private offices, those claims get billed through Medicare Part B. Now, traditional Medicare only covers 80% of medical expenses. So if your loved ones do not have a supplemental insurance that covers the other 20%, or if they are not Medicaid eligible, where Medicaid picks up the 20% that Medicare doesn't cover, that 20% that Medicare doesn't cover becomes your loved one's responsibility. So the open enrollment period for Medicare, which usually starts from around October 15th, and I know that it's about to end on December 7th, the open enrollment period allows them to sign up for Medicare Part C. And what Medicare Part C is, Medicare Part C are Medicare Advantage plans. So these are plans that partner with Medicare. Some popular Medicare Advantage plans are offered by Humana. That's a very popular Medicare Advantage plan. United Healthcare has a lot of Medicare Advantage plans. But basically what the Medicare Advantage plans do is, for a small fee, or even sometimes for no fee, they provide an add-on service that picks up the 20% that traditional Medicare does not cover. Now, I will tell you that usually if you want a plan that has no premium, that's a Medicare Part C, you will usually have to sign up with more of an HMO-based plan. And we explained at the beginning of this video how HMOs works. I'm not going to regurgitate that at this point. But if your family member signs up with a plan where they pay a small premium per month, they will usually get a Medicare Advantage PPO plan, and it'll give them the flexibility that PPO plans provide. But either way, the open enrollment period for Medicare Part C is coming to a close as of December 7th. So I want you guys to talk to your loved ones, talk to mom, talk to dad, talk to grandma, talk to grandpa, talk to great grandma and great grandpa if you're blessed to still have them in your lives, and find out if they're all good with their Medicare coverage, because they do have the option to sign up for Medicare Part C, which will help them with some of those additional costs that traditional Medicare does not cover.